Welcome to the Chad G Ortho OT podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Before we get started, I want to let you know that if you have an interesting case or topic that you want me to discuss, head over to my website, Chad G Ortho OT, go down to the Contact Me section, fill out that form, and let me know what you have going on or what topic that you want me to talk about on an upcoming episode. Thanks so much. Welcome to another episode of the Chad G Ortho OT podcast. I'm your host, Chad Guerrero, and today we're going to talk about carpal tunnel syndrome. I mean, this is something that either many of us have suffered with, or we know someone that's had this, and it can really be frustrating and, debilitating. And it's very frustrating too when you don't really know what the steps are that you need to take to try to get something done about this, or if it's just kind of written off as something else, or arthritis or whatever. And so we're going to kind of go through what this is and kind of what you need to do. And then at my clinic, some of the things that we do to treat it. So carpal tunnel syndrome is compression of the median nerve. And the median nerve is the only nerve and 9 other tendons that goes through the carpal tunnel. And this occurs at the wrist. There are 8 small carpal bones that kind of form like a U shape, and then what closes that off for the full circle is some connective tissue, and so that does make that tunnel, so to speak, that everything goes through. And the median nerve supplies sensation to the thumb, the index finger, the ring, the middle finger, and the ring finger on the side closest to the middle finger, and then the palm of the hand. So if you have pain, numbness, tingling, burning, or loss of motor control, coordination, your ability to manipulate items within those fingers of the hand, then this could be carpal tunnel syndrome. Now, if you have issues on the back side of the hand or the pinky finger or the outer portion of the ring finger closest to the pinky finger, those are 2 different nerves. So that pinky finger side, that's the ulnar nerve. And on the back side there, that's the radial nerve. And so those 2 nerves do not pass through the carpal tunnel. And so if your whole hand's going to sleep, then it's very unlikely that you would have all 3 nerves all at once being compressed. Now I have, seen different things. I've run across things in almost my 20 years of practicing. And I mean, I'm not saying it's impossible. It's just not very likely. And so if someone has this issue that's occurring over the whole hand, I would go farther up the arm, start looking around the elbow, the shoulder, the neck, things like that to rule that out, to make sure that we don't have something else going on a little further, up the electrical circuit. And so, you may notice that you wake up in the morning and your hand's asleep, and that's so frustrating. You try to shake it, or you grab it and you squeeze it and you try to get, some feeling back in it. And a lot of times as some of the blood flow kind of increases to the nerve, then your feeling or your sensation comes back and it normalizes. Now, when this has been going on for a while, sometimes months on end, or some people several years, you can have some demyelinization of the nerves. So you can have some issues with the nerves that may not come back at all if it's just being prolonged and it's still going. And so, what are the options for treatment? What can you do, and where do you start? So let's say this starts happening to you at home, and maybe you don't want to go into your doctor or your therapist or whoever that you want to see. You're busy, life's going on, whatever. And so you say, you know what? Is there some kind of brace or something that I could wear or use? Now, remember, this is going to be those areas that, just previously described that would be having the abnormal sensation. So again, if this is the pinky finger involved, or the back side of the hand, around the index, things like that, these are separate nerves. And so let's say that you think, yes, that does sound like what I have going on. So what do I do? You can go online. You can go to Amazon, Walmart.com, wherever you want to go to, or just go to Google and type in carpal tunnel brace, and that'll give you a good start. They're pretty inexpensive. I mean, probably, I don't know, $10, $12 maybe. You can get one of these, and maybe not wear all the time, but wear it at night, while you're sleeping. Okay. And that probably is going to give you some relief, at least allow you to rest a little better, wearing this at nighttime while you sleep. So you're going to start with that. And of course, I'm not telling you to take medications here, but if you're okay to take it, and a lot of times anti-inflammatories and over-the-counter things work really well. Advil, things like that, or Aleve. And again, I mean, if you have heart conditions and you're high risk for stroke and all that, I mean, you want to make sure you talk to your doctor, make sure all that kind of stuff is safe for you. But you can do that. You can also use moist heat, or some people like cold better. So maybe using a moist cold packs, because what the heat's going to do, both have analgesic effects, right? And they both can stimulate the nervous system differently for kind of numbing this pain area up. But what the heat does is it's going to relax tissue and it's going to increase blood flow to the area. Now, we do want increased blood flow to the nerve itself. Now, what the ice is going to do is decrease inflammation causing by vasoconstriction, those vessels kind of constricting up. So we're going to reduce how much blood flow that's going to the area, but we're trying to decrease the inflammation. So it's kind of like, double-edged sword. You just have to find which one you feel like works best for you, because you're going to Google and ask 100 people, and you're going to get 200 different opinions on that. And I've changed my opinion on it over the years. So, a lot of times, if it's not an acute injury that's just went on, I'd usually tell people, hey, whatever feels the best to you, use that, whatever you feel like it works. Of course, there are topical creams and things like that that you can use. I mean, um, at my clinic, I use Sombra a lot. It's over the counter. I love Sombra. I've used Helix. I've used BioFreeze. I mean, I could go on and on. All of those can help. I'm not saying those are cure-alls, because they are. It's not really fixing the issue. Then also some stretches. There's some carpal tunnel stretches. There are nerve gliding exercises that you can do. Something called self myofascial release. That's very effective. All these myofascial release tools and like little myofascial release spheres and balls and things that you can order online. And those are pretty effective. You can use that in the forearm area, because remember, those tendons going through the carpal tunnel are coming from the forearm area. So you can just use that to try to relax some of that area. I I know I have videos on these stretches on my website. So you can go to my website, you'll go across the top, and there's going to be a tab. I think it says hand and wrist videos or something like that. And you can watch one of the stretches as demonstrated in this video with two of the girls that work for me. And then also I go over in this video 3 tests that I'm going to talk about that you can do at home. So you can go to that. And like I said, go to the top, and then it's going to scroll over to hand wrist. So um, anyway, so next thing, you can, if you go to your doctor, they may prescribe you a prescription strength anti-inflammatory. They may perform injections, steroid injections and things like that into the area. And then, of course, you can go to therapy. Therapy is very effective, depending on, you know, what they do, really. I mean, I want to say all therapists are the same, because they're absolutely not. But if you go to a good therapy place that really has some experience with that, you can have great results with that. And then, of course, worst case scenario is surgery. And if you have surgery, I highly, highly recommend you ask your surgeon, if they don't prescribe therapy afterwards, to ask about going to therapy afterwards, because it definitely can benefit, and make sure that you don't backslide with anything, scar tissue and strengthening and all these types of things. So um and again, you want to make sure that this is what's going on. So to kind of add to initially what I was talking about in the areas, right? Like, geographically on the body, the areas that you're going to have, or anatomically, where you're going to have these issues. There's 3 tests I like to do. One is called a Phelan's test, and that's where you're going to kind of bend your wrist downwards and you put them together. Again, there's a great video of this that I did. It's on my website that you can check out. And then there is the reverse Phelan's test. This is called also the prayer test, where your hands are like you're praying and your elbows are up and the wrists are both in an extended position. And then the Tenell's test, which is a tapping test, where you go right over where the median nerve is at the wrist, and then also at the forearm. And so I would tap around. And I do this on both sides. I always compare both sides, because someone may be, hypersensitive on one area, and you want to make sure that what you're getting is true results. Like, it's not just like, well, this person just has sensitivity here. You want to make sure that it matches, and it is truly, a unilateral problem or a problem that you're truly having. Um, because carpal tunnel can also fool you. You can have entrapment of that median nerve in the forearm, which is known as pronator teres syndrome, where that passes, near the pronator teres muscle, and also on the humerus bone, the arm bone, just above the elbow, the ligament astralis, you can have compression there. And of course, we can go all the way up. It can be something in the shoulder and all that. So when someone comes in presenting with carpal tunnel symptoms, I go ahead, just really quickly screen all the way up through the neck just to make sure. I don't want to miss anything. And so, because my evaluations are usually pretty in depth and they're pretty long, so people stay a while. But I like to be right. Um, so anyway, so those are the tests I like to do for that. And again, that's on my website across the top. Go over to the wrist hand tab, click on that, and then you can watch that video. I also have that on YouTube. My Chad G Ortho OT YouTube channel, it's on there. You can watch it on there as well. So at my clinic, if what I do to treat it or what our approach is, of course, we use bracing or splinting at night. We like to recommend that. We use ultrasound treatment, not always, but if appropriate, we use ultrasound. A lot of times I'll mix that with an anti-inflammatory medication, and then that becomes phonophoresis, where we use that to absorb the medication better. I use class 3 and class 3B cold lasers, and so that's a painless technique that we use to improve blood flow, cell activity. I also do a lot of manual therapy, so we do a lot of joint mobilization, soft tissue work, massage type things, the myofascial cupping, the soft tissue scraping types of techniques. When you say scraping, it's not aggressive scraping, because if you go online, you're going to see people look like they've just been beat up. Right? That's not what I'm talking about with this. Just a gentle scraping, because that really helps with an area of the brain that kind of gets. It's called cortical smudging, because you have inflammation there, dysfunction with the nerve. The brain picks up misinformation on the tissue, and also I like to do some of that kind of light scraping, massage technique stuff, just to try to reduce some of that cortical smudging that may be going on. And then, of course, stretches, either, passive stretches where we're doing it to you, and joint mobilizations of things with the joints. Very effective. I like to do joint mobilizations even at the elbow. I may do them at the neck. There's a lot of research supporting cervical and thoracic mobilizations for elbow dysfunction and distal extremity dysfunction, so in the hand and all that. So some gentle things there we may do. And then, of course, some strengthening exercises. And then we also follow it with some motor control type stuff. That's the really advanced things that you want to do to be able to be very coordinated and articulate with your fingers. So because motor control is something that we don't have to really think about it; it just happens. And a great example of motor control would be if I said, "Okay, I want you to take this fresh egg and I want you to pick it up, walk 50 feet, and then sit it down. Don't drop it, but don't squeeze so hard that you break it." And you say, "Well, I ask you, well, how do you know how much pressure to put?" And you're like, well, I don't know. I'm just careful with it, right? That's motor control. That's your ability to have proprioception with the sensors, and your ability for your brain to organize this information, send the information back out to the muscles, and so that you're able to coordinate this movements that are very articulate. So anyway, that is, carpal tunnel syndrome. What you're looking at, the steps that I would go, if nothing else initially, start with a brace, see if that helps, moist heat, cold, things like that. If it keeps progressing, go to your doctor. If the family, practitioner or whatever, doesn't really know much about it or doesn't feel comfortable treating it, definitely ask for referral to an orthopedic or a therapist. And then either the orthopedic may refer to the therapist or the therapist may refer to the orthopedic. Just kind of go back and forth with that and see, because I really advise you to not let this rock on for long periods of time, because the longer that this goes on, the more difficult it is to treat and the less successful your outcomes, can be if you end up having surgery and things like that. So you want to definitely have it taken care of before it gets to that point. So, because I myself have suffered with carpal tunnel syndrome on both wrists, and I treated it and completely resolved it. So I have no issues, and I dealt with it for a little while. And I thought, you know what, Chad, it's a bad look if you're going around with this carpal tunnel and you own a therapy clinic and you're treating people with it and you're having trouble yourself. So decided to treat myself and actually listen to myself, and then it got better. So Anyway, thank you so much for listening, everyone. I appreciate the support. It's just really been great. It's on all my social media platforms, this podcast. I get a lot of great messages and support from everybody. So I thank you so very much. If you would, please rate me 5 stars wherever you listen to this podcast. And you guys have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.